Grand River Medical Group and UnityPoint, Findlay Hospital, has partnered to provide a comprehensive cancer care clinic for both the delivery of systemic cancer-directed therapy as well as radiation therapy in the convenience of under one roof.
I think having the coordinated care helps organize. They know where to go. It's easier to communicate. It's more convenient. I think that's the best part of the whole process.
I really liked having it close to home and having it here at Findlay so that I can do the chemo and radiation all in one spot.
Well, I think there's been a long-term relationship, of course, with Grand River, providing medical oncology services for this system. And I think obviously the biggest thing is co-locating us to facilitate communication between physicians and between, say, Tony Hire. And also just makes it so much easier for my staff to coordinate combined care treatments, medical oncology, radiation oncology.
I think it's a bit more of a team effort, and we're in communication more with our radiation oncology colleagues. So because of that, I think it just seems more unified.
I knew it was going to be a team. It wasn't, struggling to go from one department to the other. It's a big center, but you're still only here and they take care of you when you're here. The waiting room is never, really full because they got it all scheduled and worked out so that it just glides.
You get more, I think, one-on-one care in a smaller setting than you do in some of the bigger hospitals.
For me, it's all about patient experience. It's hard enough to be diagnosed and then have to go through treatment for cancer. So everything else that you can do to try to make that process, that journey easier for the patients is, to me, the most important thing.
When you come here, they just turn around and they make sure you're feeling good that day. You want a warm blanket, or something, they just get it for you, and it's just like home.
Everybody's kind of like family and everybody knows, you become part of the family as you go through the process.
I'm most proud of the experience my patients are able to have in this space, as well as the space it provides for my nursing staff to provide safe and effective management of their cancer-directed therapy.
Well, I'm just proud personally to have a wonderful staff. I couldn't have asked for a better group to walk into. Having had a long-standing relationship with Findlay years and years ago, just pleasant coming home. That's my major thing I like.
Ultimately, the physical space is just that physical space, but it's hugely important in helping make the patient's journey easier, coordinating it. It helps us communicate, but the people who work here, that's what I'm most proud of.
The Integrated Cancer Center means to me that I was on a long journey with a lot of steps, but with the smiling hands and the warm hugs, it was a short journey for me, and I thank them.